is in relation to overdose numbers. I know you touched on it a little bit before about the impact of COVID-19 around sort of the drug supply, a tainted drug supply, as some experts say. There's been also some fraud out there across the province, and certainly here in Kamloops, with people, low-income people, benefiting and having more money in their pocket to spend on drugs and that. What specifically can the province do to curb this problem?
Yeah, we've been dealing with this, and I have been consumed with dealing with this for a long time. And there is no single one thing that we can do. We need to continue to do many things. And as you know, I do believe, and we've seen evidence from our partners in public safety, that the toxicity has increased. And part of that is due to the supply chains being cut off, as they have been for many other things. And drugs then being either manufactured locally or cut with other materials that are toxic as well. And I think that has something and quite a bit to do with the numbers that we're seeing. We also think that there's some impact on people receiving amounts of money, and of course those people who are dealing drugs are taking advantage of people who are in that position. We also know that, with this increased toxicity, with the challenges that we have with providing services, particularly to people who use drugs who are homeless or underhoused, access to overdose prevention sites has been interrupted in some places. And we've had to change those models, and we've seen that here in Victoria and in Vancouver as well, and certainly in the interior. So those types of things are different. The access to recovery homes and access to some of the in-person treatment services has also been interrupted, as has many other medical services over the last few months. So how do we switch that over to being able to support people who use drugs in a virtual way? That's been a challenge for many people, particularly if they don't have access to the internet even, for example. And a number of the initiatives that we've started, like increased access to pharmaceutical alternatives to street drugs, that has been gradually, slowly increasing. And I talked about this last week, not as fast as widespread as we would like to see. And there's started to be some uptake with clinicians in the interior, which is good news. People being able to access drugs like hydromorphone in place of their street drugs. I think the other one that I have talked about many times is the importance of the reduction in stigma, and in particular the stigma that is associated with criminalization of people who use drugs. So I continue to push for decriminalization of people who have possession of small amounts of drugs for their own use, as a way to try and reduce those barriers, so people who are using at home, and we know that this is young men in particular in our province, that they are able to reach out to family and friends. And at this time of social or physical distancing and isolating, particularly in the last few months where we've been isolating at home, this is a very risky situation for people who end up using alone because they are afraid or are ashamed to talk to their family or their friends or their close circle about their drug use. So these are all things that we need to address, and as Minister Dick said, we have not forgotten this, and it has been underlying many of our discussions. Some of the critical needs that were being seen when we ended up with the public safety issues in Oppenheimer Park and here in Victoria and Topaz Park. One of the underpinnings of the response to that from public health has been being able to provide those people who were being offered hotel rooms and other forms of more secure shelter, the supports that they need for overdose prevention and for access to safe supply. So those initiatives continue, and we are working to ensure, with the Ministry of Mental Health and Addictions as well, to ensure that we continue to increase those services around the province. And that is a long-term strategy. It is not just for today.